Alarming infant mortality rates are something we'd expect to see in impoverished or war-torn countries, but not in the richest nation on earth. And yet that is what's happening here in Mississippi, which has declared a public health emergency over the rising infant deaths. The state just reported its highest child mortality rate in more than a decade, with nearly 10 deaths out of every 1,000 live births. That is 60% higher than the national average. Most of those deaths are among newborns, less than a month old. Some experts place the blame squarely on what they call maternal care deserts, whole communities and counties where prenatal care is literally non-existent. In fact, nearly 70% of Mississippi's rural hospitals don't even deliver babies because they don't have maternity wards. Remember, Mississippi is the poorest state in America. Nearly 1 in 5 people are considered impoverished there. So we're talking about expectant mothers with limited means, often navigating pregnancy alone. No checkups, no ultrasounds, no guidance on what to eat or not to eat, and how to care for a new baby once they're brought home. So the age-old question is what to do about it. For answers, we turn to Mississippi State Health Officer Dr. Daniel Edney. Doctor, thanks so much for joining us. So 3,527 babies have died in Mississippi before their first birthday. That's just in the past decade. What is going on there?
Well, you identified it. We're the most impoverished state in the nation, and we're a very rural state. And we're a low population state, so our population is spread out, all over our rural areas, which can make access to care difficult in the best of circumstances, and our low-income moms are not in the best circumstances. So, we have outstanding physicians, nurses, hospitals, but we have a system that needs more support, and that system needs to provide more support to our moms and babies. And that's why, when we're the worst state in the nation related to infant mortality, and we're getting worse, that we declared a public health emergency to help us fix this problem more quickly.
Do you need, obviously you can't turn on a light switch and, and create maternity wards. Those are expensive and difficult. And as you just said, you have a rural population that's really spread out. What's the answer? Is it hiring nurse practitioners? Is it hiring, they can dispense prenatal vitamins and certainly advice and do simple tests on pregnant women to make sure everything's okay.
Well, yeah, it's a complex problem with multifaceted solutions. And when you look at our infant deaths, they're in 2 categories. There are those who are dying from genetic abnormalities, which we can't do anything about, but then also our preterm low birth weight babies that we can do something about. Right. That's about half of our babies, and those babies are dying in the first 28 days of life, half of those babies in the first week of life because of severe low gestational age. And then our older babies that are dying, they're dying from issues related to not adhering to safe sleep practices, accidental deaths, and so making sure that families understand and have the resources that they know how to practice safe sleep and not practice co-sleeping in the bed with the parents where strangulations, accidental suffocations occur, but having them always on their back in a crib really can impact our older deaths. But when we look at the preterm babies, that relates to maternal health. And you cannot divorce maternal health from infant health. And we have too many pregnant moms who do live in maternity deserts where they're an hour or more away from care. That doesn't mean we need to have a birthing center in their community, because these are low population rural communities, but we can provide prenatal care and postpartum care, because we lose 47% of our moms after 2 months postpartum. We can provide that in the communities in collaboration with their OB, wherever the birthing hospital is. And that's what we're going to be doing at Mississippi State Department of Health, is standing up prenatal and postpartum care in our maternity deserts to close that gap. And so we plan to do that very quickly through the public health emergency. Elizabeth, we've been working on for the last 2 years building the obstetrical system of care, which will be our state's 4th statewide system of care. And this is where Mississippi leads the way. we will at that point have the most number of statewide systems of care in the country. We have a long history of trauma, heart attack, and stroke systems of care. Now we're building out a system to help support our high-risk moms and babies so that we can make sure that the mom is delivering at the right level of care. And if that baby does happen to be born at a lower level of care in an emergency, that the system will move the mom and baby very quickly and effectively to the right level of care. If we can get that baby into the right level of NICU at the right time, we can help save that baby's life.
I did a whole documentary on infant mortality in Memphis, which also has a very high rate. Not as high as the state of Mississippi, for sure, but very, very high.
Close.
Very close. And the real problem there was that none of these young mothers could get any prenatal care of any kind. They couldn't get any healthy food of any kind. They often went their entire pregnancy without seeing anybody, and then they gave birth to drastically premature babies that ended up in neonatal and intensive care units, NIC units, at great expense to taxpayers, when it would have been so much cheaper in the beginning just to have a nurse practitioner dispense some advice and prenatal vitamins and do a monthly checkup on these young mothers and teach them how to be mothers to these tiny newborns. In other words,
so what you're pointing out is that this is a national problem. This is not just a Mississippi problem. We're just in the worst of situations with it. This is a national problem, but Mississippi's doing something about it. Two things Mississippi has done as a state is we have approved presumptive eligibility for Medicaid. So just as soon as a mom knows she's pregnant, we can get her Medicaid turned on immediately. And then also extended 12 months postpartum Medicaid coverage, which really covers a danger period for a full year after delivery. Just because they delivered doesn't mean everything is okay.
Absolutely not.
And then investing, as other states are not doing yet, into a comprehensive obstetrical system of care. We will be the first state with a comprehensive system of care directed solely at high-risk moms and babies that I think will be a big part of the solution. Plus doing what you're saying and extending basic prenatal and postpartum care out into our rural counties where it's needed. These are all things that are active development.
Well, you certainly need it. A state of emergency is a pretty big thing, and the numbers and statistics of the numbers of babies dying in your state is astonishing that we're having
But I want you to know that this is the public health emergency is a sign that we refuse to accept this as our reality.
I hope so.
And all of us in Mississippi are working as hard as we can to do this. So watch what we do and watch these numbers come down.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.